Agietoxib 90 Detailed Information Note 1. Composition of Agietoxib 90 Active ingredient Etoricoxib 90 mg 1. Composition of Agietoxib 90 Excipients Anhydrous Dicalcium Phosphate, Microcrystalline Cellulose, Croscarmellose Sodium, Magnesium Stearate, Hydroxypropyl Cellulose, Sodium Lauryl Sulfate, Povidone, Talc, Titanium Dioxide E171, Red Iron Oxide E172, Yellow Iron Oxide E172, Black Iron Oxide E172. 2. Pharmacological action of Agietoxib 90 Etoricoxib is a nonsteroidal anti-inflammatory drug NSAID that exerts anti-inflammatory, analgesic, and antipyretic effects. It functions as a potent and highly selective inhibitor of Cyclooxygenase 2-COX2, demonstrating good oral bioavailability. 2. Pharmacological action of Agietoxib 90 Cyclooxygenase COX is an enzyme involved in the production of prostaglandins, which contribute to pain, swelling, and inflammation. By inhibiting COX2, Etoricoxib reduces prostaglandin production, effectively reducing pain and inflammation. 2. Pharmacological action of Agietoxib 90 Due to its selective COX2 inhibitory action, Etoricoxib minimizes gastrointestinal toxicity and doesn't affect platelet function. 3. Pharmacokinetic properties of Agietoxib 90 Etoricoxib is rapidly absorbed after oral administration. Peak plasma concentrations are achieved within approximately 1 hour. The drug is primarily metabolized in the liver and excreted in feces and urine. The elimination half-life of Etoricoxib is around 22 hours. 4. Indications for Agietoxib 90 Symptomatic treatment of acute and chronic pain in adults, including pain due to osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, chronic low back pain, dental pain. 4. Indications for Agietoxib 90 Post-surgical pain, reduction of pain and inflammation in dysmenorrhea menstrual cramps, pain due to osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, chronic low back pain. 4. Indications for Agietoxib 90 Dental pain, post-surgical pain. 5. Contraindications of Agietoxib 90 Hypersensitivity to Etoricoxib or any excipients of the drug. Patients with asthma, nasal polyps, or aspirin or other NSAID allergy. Patients with active peptic ulcer disease or gastrointestinal bleeding. Patients with severe heart failure. Patients with severe liver disease. 5. Contraindications of Agietoxib 90 Pregnant women and breastfeeding mothers. 6. Precautions when using Agietoxib 90 Patients with a history of cardiovascular disease. Etoricoxib may increase the risk of cardiovascular events, including heart attack and stroke. Careful consideration is necessary before using this medication in such patients. 6. Precautions when using Agietoxib 90 Patients with a history of liver disease. Etoricoxib is metabolized in the liver. It should be used with caution in patients with liver disease. 6. Precautions when using Agietoxib 90 Patients with a history of peptic ulcer disease. Etoricoxib can cause peptic ulcer disease. It should be used cautiously in patients with a history of peptic ulcer disease. Elderly patients' dose adjustment may be necessary for elderly patients. 6. Precautions when using Agietoxib 90 Patients with renal impairment. Dose adjustment may be necessary for patients with renal impairment. Common headache, nausea, diarrhea, gastritis, dizziness, uncommon edema, hypertension, elevated liver enzymes, allergic reactions, rare peptic ulcer disease, gastrointestinal bleeding, heart failure, stroke, cardiac arrest. 8. Drug interactions. Warfarin. Etoricoxib may increase the effects of warfarin. Lithium. Etoricoxib may increase lithium levels in the blood. Methotrexate. Etoricoxib may enhance the toxic effects of methotrexate. 8. Drug interactions. CYP3A4 inhibitors. CYP3A4 inhibitors like ketoconazole and itraconazole may increase Etoricoxib levels in the blood. 9. How to use Agietoxib 90. Take the medication as instructed by your doctor. Do not alter the dosage or discontinue the medication without consulting your doctor. Swallow the tablets whole with a full glass of water. Do not chew or crush the tablets. 10. Storage of Agietoxib 90. Store the medication at room temperature, in a dry, cool place away from direct sunlight. Keep out of reach of children. 11. Additional information. Agietoxib 90 is a prescription medication. It should be used only as directed by a physician. Do not self-medicate with this drug without consulting a doctor. Note: the information provided here is for general knowledge and should not replace professional medical advice. 11. Additional information. Consult your doctor or pharmacist before using this medication. Always read the accompanying leaflet carefully before using any medication.